I mean, stroke was one of the ones that I literally fell out of my chair. 70% of the patients I looked at had a stroke every year for 4 years. I mean, it doesn't take a rocket scientist to know people don't have strokes year over year. They usually die if they have two.
Corporate fraud works best in the shadows, behind corporate walls. How does the government bring these wrongdoers to justice? Whistleblowers. These are the stories of those who risk their careers to shine a light on allegations of fraud. Today on Fraud in America.
On today's episode of Fraud in America, we're going to spend time with Sutter Health whistleblower Kathy Ormsby and her attorney, Kate Scanlan, of Keller Grover, LLP. Ms. Ormsby alleged that the hospital system was engaged in a massive fraud scheme targeting the Medicare Advantage program. Specifically, she alleged that Sutter Health knowingly submitted false, inaccurate, and unsupported medical diagnosis codes that inflated Sutter's reimbursements from the Medicare Advantage program. In time, the government intervened in Ms. Ormsby's 2015 False Claims Act qui tam action, and in August 2021, Sutter Health settled the allegations and paid $90 million. Today, we go beyond the numbers on this episode of Fraud in America. All right, welcome to today's episode of Fraud in America. As I said in the intro, we're joined today by Kate Scanlan and Kathy Ormsby. But the fraud here, the allegations that we're going to go into involve Medicare Part C, a topic that we really haven't discussed on this show, but it's an area of tremendous growth. Matter of fact, 4 out of every 10 Medicare beneficiaries are currently in this program, Medicare Part C, and it's grown. It's actually doubled over the last 10 years. And this growth has caught the attention of the government. They want to make sure that government dollars are spent appropriately. Kate, I'm hoping you can help set the table here and explain what is the basic allegations here? What is this Medicare Part C that we're going to be talking about today?
Hi, Jeb. Thanks for having us here today. The significance of what happened here is twofold. So the Medicare Advantage program, the government has an intermediary, an insurance company that it contracts with to oversee the care for these patients who are enrolled, the beneficiaries that you described. And those are referred to as Medicare Advantage organizations. And then those organizations contract with healthcare providers, the doctors, the hospitals, the labs, the clinicians, anybody that you need to go see as a patient. So one of the first things that was interesting and unusual about this case was that Kathy was reporting a fraud that was happening at the provider level. This was not one of these insurance companies that was doing this, which had been sort of historically how frauds had been reported in this area. And it wasn't just any provider. Sutter is one of the largest healthcare providers in the state of California. So it was a really, really significant number of patients. It was a big provider, and it was this Part C program that you're describing that was of interest to the government.
So let's go back. Let's go all the way back. Can you take us back to your childhood I believe it was in New York, right? You were in New York State?
Yeah, that was a while ago. My childhood. So I was born number 16 and 17 of 18 children. I have a twin brother. I was in medical billing most of my adult career, and somebody came up to me one day and said, "You really should get this certification." And I'm like, "Yeah, really, I don't like coding. I don't want to do this. I really don't want to do this." And she's like, "Well, you're in it now, and if you intend to stay on it," and I was a single mom then, raise my 2 boys on my own, then you better get this certification. And so I did. I got certified with AAPC, and then I decided I wanted to vacation in California, and I fell in love. I am in the middle of a postcard and I have to live here. So I went back home and I started Googling coding jobs. And this job is training physicians on Medicare Part C, which I had no idea what that was. I'm like, well, you know what? If it's meant to be, it'll be. So I sent my resume, and surprise, surprise, they called me and did a phone interview and flew me out to beautiful San Jose, and basically said, "Hey, if you pass all of these the background checks and health checks, then you got the job." Think I'm going to be rich, right? Coming from small town New York, and my salary tripled coming here. I'm like, "Oh yeah, I'll take it." And they taught me absolutely everything I know about Medicare Part C. It got to a point where I could do the job in my sleep, and I was getting very bored and not stimulated. And a friend of mine said, "Hey, Sutter's looking for someone to set up a risk adjustment program. I think you would be great for it." And so I did. I interviewed with the revenue cycle vice president, and it was amazing. And I just felt like, again, this is the way I'm supposed to go.
This is 2013, is that right, when you signed on with Sutter?
Yep. At that time, I was hired as a RAF project manager, and I walked into a cube with absolutely nothing. There was no one to follow. There was no manual, no documents, nothing. And so I completely, from ground zero, created the whole department.
So, given that your False Claims Act key tam complaint was filed 2 years later, right, in 2015, so I'm guessing that concerns boiled up to the surface pretty early on. Can you talk about some of the concerns that you had?
Yeah, so one of the first thing I single-handedly did was I said, in order to know where to start training these physicians, I need to know where they're at. What do they know? And so I did a random pull sampling of, geez, I think it was 20 to 40 primary care physicians. And I can't remember exactly what the accuracy rate was for that. Maybe Kate does because it was in all of my paperwork, but it was scary bad. I mean, there were so many things that needed to be deleted and sent back to Medicare, and the doctors, they just didn't know what they were doing. And so I brought those results to my manager, and I said, "Hey, I need help. We need to really start looking at this. We need to get some training out, and we need to have some auditors." So Sutter said, "We have X amount of dollars to pay for your department, and how are you going to use it? Coders are expensive." And I said, "Well, what if I hired brand new coders? So they can't get jobs because they don't have the experience. But what if I hired them at 50% less than what they should be making, and then over a year, if they do great, we can increase their pay?" And they liked that idea. And so I hired 5 of them and trained them my way, which is the right way. And we did amazing work. I mean, we found a lot of things that needed to be returned, but we also found a lot of opportunity for training and training the physicians what needed to be documented in the note. And they were actually making money, but they also needed to pay money back. And everybody thought I was doing a great job and pat me on the back. And then all of a sudden it stopped. They
Mm,
started asking questions like, "Why are you looking back? Why are you looking at old stuff? We already have this money. We want you to start looking and increasing the RAF score." And my certification says that's not what you do. You have to
mm,
look both ways. You have to do the right thing. And if you see something that's wrong, you need to do a look back and make sure that there isn't a trend that this hasn't been going on. And if it has been going on, what are you going to do to correct it? And so I kept sending emails and going to meetings with vice presidents and saying, "Hey, this is what's going on here. We need to send this money back." And then, long story short, my boss gave me a phone call and she said, "You and your team are to immediately stop coding. I want no more auditing taking place, period." I'm like, "Oh, okay." So she said,
wow.
"Immediately call a team meeting." And so that's what I did. I told them we needed to stop. And I tried to be optimistic and said, "Well, maybe they're looking at all this fraud now. Maybe there's somebody's taking an interest and they want us to stop because they got to figure out what they're going to do." So this is good news. I feel like this is good news. In the back of my mind, I knew it wasn't. And so time went on, and I'm not getting any feedback. So I actually called the compliance officer. She called me, and I said, "What's going on with this? We've reported this. This is a huge issue, and we're talking millions and millions of dollars that need to be sent back to Medicare." And she said, which really scared me, she said, "Kathy, I'm just going to be honest with you. I don't even know what an HCC is. Can you explain that to me?" And I'm thinking, wow, you're making the decisions on what to do with all this fraud and you don't even know what it is. And, I explained it to her the best that I could. And then that was the end of the conversation. And maybe a month or two went by. And again, I emailed them again. I'm like, "What's the status? What's going on?" Because I know that if you're not correcting what I brought to you, that I need to take it higher. In the meantime, I'm emailing Medicare and thinking, if Medicare comes in and they see what's going on here, how am I going to protect myself and my team? what am I going to do? So I sent them an email. I need to know what to do. And I didn't get a response. So now I'm like really panicking. And what really was the straw that broke the camel's back was I sent another email to the compliance officer and I said, "Hey, what's the status? What's going on?" And her response back was, "This could take years, years for a resolution." And I said, "That's not acceptable. What are we going to do?" And she said, "You just need to stop coding." And I said, "That's it. I'm really afraid, what am I going to do? I'll lose my certification, and my team, we became family. They relied on me to keep them safe too. And I felt an obligation to make sure somebody was doing something to protect us if this all comes down. And so I started Googling, what do you do when you see fraud? What are you supposed to do? Well, I knew what I was supposed to do. I had to escalate it to the next level. And so I Googled and Kate's name came up and I said, "Hey, it's Kate. Maybe it's Kathy. Maybe this is a sign." So I called the thought of being a whistleblower never crossed my mind. What I called Kate for was to say, "Hey, this is what's going on. I've reached out to Medicare. I've documented absolutely everything from the day I started." And I said, "What do I need to do, Kate, to protect myself?" And she said, "Wow, we need to talk. Are you free this weekend?" This is a whistleblower case. The way you protect yourself is to report this to the government, and we'll take it. And that's how it started.
So you said, that there was this high, I guess, error rate, right? That there were constantly, or there seems to be this pattern of saying patients were, I guess, were sicker than they really were. Um, why did that matter so much to the government in the long picture of
Well,
Medicare Part C?
well, for me, why it matters so much to me was they received money to take care of patients that were sick these patients weren't sick. An example is stroke. I mean, stroke was one of the ones that I literally fell out of my chair. I worked with an analytics team over consecutive years. Patients, I would say, from the best of my recollection, there 70% of the patients I looked at had a stroke every year for 4 years. That's approximately, I don't know, I'm just going to throw a number out there, but about $3,000 per instance. And I mean, it doesn't take a rocket scientist to know people don't have strokes year over year. They usually die if they have two. So what's going on here? And I went in and I looked at the records, and it was one after the other, after the other, after the other. It was wrong. And it was the same for fractures and cancer. And so Sutter was getting all this money to manage all these poor people that had strokes and all these poor people that had um, fractures and cancers and heart attacks that they didn't have. This money needs to go back. This is taxpayers' dollars.
And Jeb, let me jump in here a little bit, just kind of, I'm going to fill in some of the background here. So when Kathy did her audits, she chose cancer, fracture, and stroke because she knew that they were commonly miscoded. And the reason that's so important in the Medicare Part C program is that the provider is given a base payment to take care of a beneficiary. And then for every additional condition they have, they get a little increase in how much they get paid. The problem that Kathy was seeing was that the record was still showing that Mrs. Smith had an active stroke for 6 or 8 or 10 years in a row, which meant that Sutter was getting that $3,000 in 2011, in 2012, in 2013. Mrs. Smith, at the end of 2010, when she recovered from her stroke, should have been changed to a history of having had a stroke, which then would have been a signal to her doctors to know how to take care of her. But nobody was treating Mrs. Smith for an active stroke for 10 years in a row.
We've heard this story so many times, right? That Kathy was basically being told, "Stop doing your job so well. You're uncovering money that we got to return. So please just stop and go away." When you heard the story, what was your thought?
Well, first of all, Kathy and I hit it off like a house on fire right from the first call. And I think from Kathy's perspective, it was also, she was vetting me to see whether this was somebody that she was going to trust. So we each passed the respective first test. And then I think the next thing that was so critical about Kathy's story was that she had the evidence to back this up. So it was at every single turn, I would ask Kathy a question and she'd be like, "Hold on a second." And then she'd pull out a document to evidence the answer to whatever the question was. That was really, really important in how Kathy was able to evidence what she was seeing inside at Sutter.
Such an important point, right? We get so many phone calls from potential whistleblowers that have allegations, but that evidentiary proof is so important in order to bring these cases. So, Kathy, you are at this point a single mother and you're worried about your certification. You're working for an employer who allegedly might be committing fraud, and you decide to go forward. What was the point in which you decided there's no other option?
After I met with Kate and Jeff, I think it kind of hit me like a brick. And I have always taught my coders from the beginning, compliance is number one. Money is number two. We always do the right thing every single time. And as I was telling Kate and Jeff the story, and knowing that I had documented everything, it hit me like I got to do this, because if somebody else reported it, I just know Sutter's going to come back and say it was Kathy's fault. We didn't know this was going on. And I'm like, Kate, we got to do this. I got to do this, and I got to do this now because I can't lose my certification. And I think it was at that point when they were at my house that I decided I had to go forward.
These cases sometimes can take years, and a lot of times they're under seal, and you're not able to talk about them. Can you talk about this time when this case is under seal? What you were going through?
Well, everybody has drama in their life, right? No matter, how good your life appears on the outside. But personally, on a personal level, it was extremely stressful because obviously I couldn't talk to anyone or tell anybody what was going on. Even my team at Sutter, my sons lived in New York at the time, and my youngest son wanted to come to California and start his life over. And it was at the same time that I had to start meeting with the big meeting with the government and having to meet with my team of lawyers in San Francisco. And here's my son, Mom, I need you. And I got to go, where are you going? Well, I can't say. And I had all this anxiety about it anyway, and was gone for a whole weekend once, and I couldn't tell him where I was going. And my boyfriend of 6 years who I lived with, I couldn't tell him what it was all about. And of course, that looks very suspicious, and then I totally understood his suspicion, and then I felt guilty because I couldn't tell him, and I felt like I was lying. And yeah, it was just really difficult. I mean, as a matter of fact, I actually had to reach out to a therapist because I need somebody to talk to. And it was very stressful.
And what Kathy is describing is, unfortunately, few people that she was able to talk to were her legal team. So, whether that was about the case or whether it was, the stress of what she was having to navigate in her life, we were the only people who knew both halves of what was happening. Unfortunately, there's not a lot that we can often do for solutions. Sometimes there are, but a lot of the times it's just to be there to listen, and just so that Kathy or whoever our client is has some place to let the pressure valve go.
Yeah. So the one part of the story that a lot of people talk about is that meeting with the government when you're sitting at a table with people from agencies from every letter of the alphabet. Can you talk about that moment?
Yeah. So again, that was just another big stressful, stressful thing. Well, it started out stressful anyway. And so the first thing that obviously happens when you go to the courthouse is that you have to walk through the metal detector. And for me, that was one of the most stressful things that happened that day, because I felt like, wow, this is what it feels like to be a criminal. Am I a criminal? No, I'm not a criminal. I'm doing the right thing. But it was just the stress of it all. Like, and then, walking into that big room with all these upper level government officials and having to tell my story and keep everything straight, and just being able to talk was really hard. But ultimately, you do your self-talk, right? So I talk myself down with things that I would say to myself, that I'm not the criminal, that I'm doing the right thing, and that I'm telling the truth, and they're here to support me. I got lawyers, wonderful lawyers on my side that believe my story, saw my evidence, and I couldn't have made it this far if they didn't believe me. So the mental talk that I had to tell myself to calm myself down, and it was stressful.
Kate, can you talk about the role of the Relators Council during this time when the case is under seal, and the role that we play in helping them through this process?
Yeah, even hearing Kathy describe it again, like my heart breaks a little bit because we as lawyers become so desensitized. I will say that the other thing I remember distinctly on this was that Kathy just couldn't even put food in her mouth because she was just so nervous about this whole thing. So, you know, the job of the lawyer at this stage of the process is to start to see some of those things and be able to anticipate and address those personal kinds of questions. And one of the things that we did was we got Kathy out of her home for the weekend before her relators interview and got her set up at Jeff's house on the beach. And she just spent this beautiful sort of spa like weekend to kind of get her head in the right space because we knew that she had great information and that when she actually took the deep breath and kind of exhaled, that her truth and her story would come out. We just needed to give her that skill set and that time to take the deep breath so that she could then exhale. So that was the first part. And then the second part of what we all do as relators counsel when we do all of this is we prepare our clients before they go into that interview. And it's a two-edged sword, right? Like part of what we're doing is we're asking Kathy all of the hardest questions to make sure that she knows how to answer them. And so we're preparing her for that. But at the same time, you're kind of getting her riled up because she's like, oh my God, they're going to ask me that. And so, but our whole philosophy is it's so much better to have an awful hard prep session and then walk out of the interview and be like, God, that wasn't nearly as bad as what you guys did to me 2 days ago, right? That's when we've done our job right.
So the Sutter eventually settled, paid a check. They're now under a corporate integrity agreement. Kate, why does this case matter so much?
That's such a great question, Jeb. And I'll go back to where we started. I think that the first part of it is that this was a provider. This was a case where Kathy was able to demonstrate that the Medicare Advantage fraud was happening at the provider level. And I think it also matters in a way that is less related to the financial part of it and more related to sort of what we've all figured out in the pandemic, which is what Kathy was finding was inaccuracies in these patients' medical records. Our fictitious Mrs. Smith, who has active stroke for 10 years. And if we have learned nothing during the pandemic, it is that people are evaluating your risk of disease based on your comorbidities. And if your health records are not accurate, you are not going to get the best quality care when you go in, whether it's for COVID or the flu or whatever. And so what Kathy was talking about at its core was quality health records so that every one of these Medicare Advantage beneficiaries had the best chance to get quality care, that every doctor who looked at their medical records was going to see accurate information about what was the state of their health. And going forward, I think that is a critical message out of this, is that we all need accurate records and accurate documentation.
I think if we've learned anything over the last 2 years, it's not how long you live, but how you lived that matters. And Kathy, I'm just really honored to know you, and I'm honored to know you, Kate. This case matters on so many levels, well beyond dollars and cents. And I'm just very thankful. There's people like you who are doing the right thing, that recognize there's a right and a wrong way to do things, and they are not only pushing themselves, but encouraging others to step forward. So I just want to acknowledge you for the courage to do that on behalf of every patient in the world who needs to have an accurate medical record. Well, Kate, Kathy, thank you for joining us. Until next episode of Fraud in America, if you see something, say something. And if that doesn't work, do something. We hope you enjoyed today's episode of Fraud in America. Today's episode was made possible because of the generous donation of longtime TAF supporter and whistleblower attorney David L. Herron. If you believe you have witnessed fraud against the government or fraud on the financial markets, we encourage you to visit our website at taf.org, where you will find a directory of member attorneys who represent whistleblowers across the country. On our website, you will also find additional information about our nation's various whistleblower laws and programs and a way to donate to our organization as we step forward in spreading information about whistleblower programs. This episode was edited and produced by Rachel Brooks, and our theme song is by Connor Chaos. A big thank you to our TAF staff and researchers of James King, Emma Bass, Jackie DeMar, Kate Scanlan, Max Boldman. Fraud in America is a project of Taxpayers Against Fraud Education Fund. The opinions expressed on today's show belong solely to the guest and are not necessarily endorsed by the organization. Thank you for joining us on today's episode of Fraud in America.